Hello and welcome to the CardioSmart community on CardioSource. My name is Dr. Andrew Freeman and I'm editor-in-chief of this new site. I'm joined today by Dr. John Spertus, Director of Outcomes Research at the Mid-America Heart Institute in Kansas City. He's also the Missouri Lauer Endowed Chair at the University of Missouri in Kansas City. Today, we'll be talking about patient-centered care, specifically informed consent. Welcome, John.
Thank you, Andrew. I'm thrilled to be here.
So today, you've been doing some very innovative things with patient-centered care. And in particular, I'd like to get your take on what patient-centered care means to you and how it applies to the informed consent process and what kind of work you've been doing.
Sure. Well, the Institute of Medicine really wrote a seminal report about 12 years ago now, where they really decried the current state and quality of healthcare in America and felt that we could do much better. And among the 6 pillars that they said could really lead to better quality care in America, one of the most important was patient-centered care. Others had to do with delivering evidence-based care and delivering more cost-effective care, more equitable care, etc. And the patient-centered care is really around trying to tailor our treatment to our patients to meet their individual needs, goals, and values, and ideally to engage them in a process of shared decision-making so that we can try and really tailor therapy to the needs of individual patients based on what they needed and valued, and to communicate that in a way so that they were active partners with us in getting and delivering and complying with healthcare to maximize the outcomes they value most. Our group's been very interested in trying to address the needs articulated by the Institute of Medicine by creating the infrastructure to deliver evidence-based personalized medicine in a format that could really engage the patient in participating in the treatments that best meet their personal needs. And towards that end, we began about 7 years ago now at St. Luke's Mid-America Heart Institute in delivering personalized consent forms. And we've done this in the setting of angioplasty to begin with the hopes to expand this into many dimensions of care and shared decision-making with patients about treatments ranging from coronary artery disease to intraventricular cardiac devices to even anticoagulation for atrial fibrillation.
Okay, so a lot of folks, when they come for a procedure, they get a consent form. The doctor says, this is what we're doing, here's some of the major risks, sign here. How is your process different?
So exactly. So in most hospitals, including our own prior to this effort, we had a generic consent form used for all procedures that had a lot of highly sophisticated legal jargon that basically limited the hospital's risks and had blank lines to put in what the procedure was and what the risks were. And we transformed that in the setting of angioplasty to create individualized consent forms for each person. And the first step was to change the consent form from that generic legal form that in our hospital was written at the 16th grade level, meaning you had to be a college graduate to read it, to a much simpler consent form written at the 8th grade level that had pictures about what's an angiogram, what's angioplasty, what's a stent, and importantly, that embedded within it that patient's specific risks for bleeding, for dying, and importantly, for having to come back in a year for a repeat procedure if they got a drug-eluting or bare metal stent. And the hope and intent was that by allowing patients a format for consent that they could read and understand before the doctor came to talk with them, the doctor and patient could have a much higher level, much more informative discussion about what the risks and benefits of the procedure were for that patient, and also to help use that as a foundation for deciding, is the reduction in the risk of a repeat procedure worth it to that patient in exchange for their obligation for prolonged dual antiplatelet therapy if they chose a drug-eluting stent. And it has worked very well in our institution in having patients understand what the risks and benefits of treatment are and to engage more in discussions with their doctors about stent choice.
So have the patients, when they've seen this new technique, which they're probably not accustomed to since you're pioneering this, have they responded positively to it, or do they end up becoming scared and leaving the procedure?
No. It's worked very well. So as an anecdote, generating the consent form requires some more effort, about 2 minutes for nurses to essentially enter the patient's risk factors and print out the informed consent document. And what we found was when we initially started the project, the nurses were very, very skeptical. We had to buy them a lot of pizza, explain it, and we did it as a 3-month pilot. After that 3-month pilot, the nurses felt that this so favorably enriched the patient's experience that it was, in fact, at their urging that we've continued it for the last 7 years at our center, and in fact expanded it to the other hospitals in our healthcare system that also do angioplasty. So the feeling from formally asking patients about their experiences, but also the anecdotal gestalt of the nurses and the others caring for the patients, was that this was very helpful in improving the patient's experience and actually allaying their fears and concerns of angioplasty. Even though they get the exact risks given to them, their anxiety levels were much lower in getting that in a form that they could understand and to be able to talk with their nurses and doctors about the procedure.
Well, I think this is fantastic and clearly the future of medicine. So I'd like to thank you very much, John, for spending time with us today and telling us about patient-centered informed consent. Continue to tune into the CardioSmart community for more information on the value of patient-centered care. I'm Andrew Freeman, and I thank you for watching.
Thank you so much.